Hi, my name is Dre. I'm a charge nurse on the acute care of the elderly unit at the University of Colorado Hospital. And today I'm going to be giving you a short presentation about delirium and what that looks like in hospitalized older adults at our hospital. So this education is for volunteers, and it is meant to help instruct you just so you have a little bit of background before going into work with patients. So it is titled Delirium in Older Adults. What is delirium? Delirium is a sudden and usually a temporary change in mental status. This can cause a person, a patient, to be confused, disoriented, unable to think clearly. They can also have behavior changes. And it can affect up to 50% of hospitalized older adult patients. And it can be brought on just by the unfamiliar environment of the hospital itself. That can actually cause a person to become delirious. This slide here shows you what delirium could look like in patients. It shows you different behaviors, different ways that the patient might be interacting with you if they're experiencing delirium, and then also some emotions that they might be experiencing if delirium is being triggered. Some of the behaviors that these patients might be demonstrating are they might have difficulty reading or writing, staying focused on what you're saying. They might be irritable or restless. You might go into a room and they might be like pulling at things and just kind of restless in the bed or the chair. They might be calling out. They might be agitated. Usually volunteers, we don't send them into rooms where patients are agitated, but that is something that these patients might experience. It's also very common that they're hypoactive, so they're just not wanting to do anything, and also hyperactive, where they're just very, very busy. Some of the different things that can happen when interacting with them, they might not respond to you if you're asking them questions in a conversation. They might have difficulty maintaining focus on what you're saying, or they could get stuck on an idea and then start repeating things that are just going back to that same idea over and over again. They might have difficulty retaining any new information. They might be rambling or switching topics, very easily distracted. Those are all things that you might experience as a volunteer when you're interacting with these patients. They might, some of the emotions that can come up if a person is experiencing delirium could be depression, emotional fluctuations. They might be withdrawn, or they also might have rapid speech. So these are all just things that you might, just to be aware of, so that you might know what this looks like when you're going into a patient's room and you're interacting with them and they're not responding the way you might think is a normal response. Delirium symptoms. Delirium can come and go throughout the day. Oftentimes in older adult patients, it gets worse as the evening approaches. So delirium can sometimes be worse at night, and this can be triggered by not sleeping during the night and being awake all night and then sleeping all day long. That can cause delirium to be worse or can trigger it. And then this is where volunteers can come into play and help us, because you can help us keep patients awake during the day so they sleep at night. Causes of delirium can be emotional stress, an acute infection or an illness, malnutrition, dehydration, untreated pain, a traumatic injury such as a fracture. A lot of older adult patients fall and break a bone, and that's why they're in the hospital. Surgery and some of those medications they receive during surgery can cause them to become delirious. Medications, infections, lack of adequate sleep, which we discussed, and then also some patients are withdrawing from alcohol or drugs, and that's why they're in the hospital. So that can be a different type of interaction as well. These are the risk factors. If a patient has any of these things happening, it will make them more likely to develop delirium while they are in the hospital. So if they are older than 70 years of age, If they're socially isolated, even just being in the hospital causes them to be a little more socially isolated. Not moving around, being stuck in a hospital bed, lack of movement can cause this. Having multiple medical problems, already having a brain disease such as dementia or Parkinson's disease. These patients are more likely to have a delirium episode while in the hospital. Change of environment, if we change their room around or just the new hospital environment itself. Chronic disease, depression, and then poor eyesight or hearing loss. So if the patient's sensory items are not intact, if they don't have their glasses on, if they don't have their hearing aids in, if they don't have their dentures in, if any of that is missing, that can also trigger delirium. And then delirium is different than dementia. This slide shows you the differences between them. They can look similar, but delirium is an acute, temporary, confused state. It's something that develops over days to weeks. It fluctuates, and it is an abrupt onset. So all of a sudden they're in the hospital, and then they're just different. They're suddenly confused. So they might not have been confused at home, but then they come to the hospital, and then the hospital triggers that, and they're confused. It is preventable, and it is reversible in most cases. Dementia is different. This is a longer progression, is a chronic progressive confusion that develops over a longer period of time, months to years. It's not reversible. It's a cognitive decline, and it's not preventable. These are some of the outcomes that if a patient experiences delirium, this is some of the things that could happen due to that. So they come to the hospital, they broke their hip, now they're experiencing delirium, and now they've fallen again in the hospital because the delirium's causing them to become agitated or restless. So they can experience a higher risk of falling or a wound developing while they're in the hospital. They have a slower recovery time, can have a longer length of stay. They also might be discharged to a nursing home after they leave the hospital, and they no longer can go back to their home. And there is an increased risk of death that can happen as well. Studies have shown that the best treatment for delirium is prevention. And the key to this here is that volunteers have been shown to help these patients in reducing delirium. And that is really exciting because it means that you have a vital role in helping us help the care that we're providing for these patients. Volunteers can help reduce delirium by doing the things shown here. These are all the things that nursing staff knows to do with patients to help reduce the risk of developing delirium, but there are things that volunteers can do to help with vision and hearing assistance, emotional and social support, nutrition and hydration, basic hygiene and cleaning needs of the patients, reorienting them, and then also helping with some forms of mobility assistance. The orientation and the videos that you are going to be provided with are going to go through each of those areas and provide you with different activities as a volunteer that you can do to help meet those patient needs. These videos will be provided to you in sections, so you'll be receiving them one at a time, and you can just learn to incorporate some of those things into your practice in working with patients. We are so thankful that you are wanting to be an age-friendly volunteer and work with patients to help us prevent delirium. We are very excited for you to have this opportunity with us.